In this guide, we'll walk through 8 important warning signs that deserve medical attention. These aren't just minor inconveniences of aging. They're signals that something specific is going on in your body that needs to be addressed. By learning to recognize these signs, you can take control of your health, maintain your independence longer, and enjoy a better quality of life. 1. Losing weight. Without trying. Have your clothes been feeling looser lately? Has stepping on the scale revealed you've dropped a few pounds without changing your diet or exercise routine? While many people might celebrate unexpected weight loss, for older adults, it's actually a serious warning sign that something's not right. Here's what you need to know. If you've lost 5% or more of your body weight over 6 to 12 months without trying, that's about 7 to 8 pounds for someone who weighs 150 pounds. It's time to see your doctor. Even smaller amounts of weight loss can be significant if you have other health conditions. Your body doesn't just decide to lose weight on its own. There's always a reason, and finding that reason is important. Sometimes it's as simple as a medication making food taste different or reducing your appetite. Depression, which is common but not normal in older adults, often causes people to lose interest in eating. Dental problems might make chewing painful, so you eat less without realizing it. More serious causes include thyroid problems. When your thyroid gland goes into overdrive, it's like having your body's engine racing all the time. Chronic infections that your body is fighting can burn through calories. Digestive problems might prevent you from absorbing nutrients properly. And yes, in some cases, unexplained weight loss can be an early sign of cancer. The key point is that all of these conditions can be treated more effectively when caught early. When you see your doctor, they'll ask about your eating habits, check all your medications, and do a physical exam. They'll likely order blood tests to check your thyroid, look for signs of infection or inflammation, and make sure you're not anemic. They might also update any overdue cancer screenings. Don't be alarmed by all these tests. They're just being thorough to find out what's causing the weight loss. While you're waiting for your doctor's appointment, keep a food diary. Write down what you're eating and how much. Note if foods taste different or if you have less appetite than usual. This information will help your doctor figure out what's going on. In the meantime, try to eat nutrient-rich foods and consider nutritional drinks like Ensure or Boost. But remember, these are temporary helps, not long-term solutions. 2. Memory problems that affect daily life. We all forget things sometimes. You might walk into a room and forget why you went there, or take a moment to remember an acquaintance's name. That's normal at any age. But when memory problems start interfering with your daily life, that's when it's time to pay attention. The key difference between normal forgetfulness and concerning memory loss is how it affects your daily activities. If you're asking the same question multiple times in a short period, getting lost in familiar places like your own neighborhood, having trouble following recipes you've made for years, struggling to manage bills or medications you've always handled fine, or forgetting entire conversations or events, these are warning signs that need attention. Let me give you an example. It's normal to forget where you put your keys. It's concerning if you forget what keys are used for. It's normal to forget someone's name momentarily. It's concerning if you don't recognize familiar faces or forget the names of close family members. While everyone fears Alzheimer's disease, many memory problems have treatable causes. Medications are a common culprit. Sleeping pills, anxiety medications, and even some allergy medicines can fog your thinking. Low vitamin B12, which is common in older adults, can cause memory problems that improve with simple vitamin supplements. Thyroid problems, depression, and even dehydration can affect your memory. Sometimes what looks like dementia is actually delirium, a sudden confusion often caused by infections, medication changes, or other illnesses. Unlike dementia, delirium can be reversed when the underlying cause is treated. Even hearing or vision problems can make someone seem confused when they're really just not getting all the information. Don't put off talking to your doctor about memory concerns. The doctor will do simple memory tests in the office and check for all the reversible causes I've mentioned. They might order brain imaging or refer you to a memory specialist. Early diagnosis is crucial. If it is early dementia, medications and lifestyle changes can help slow progression. If it's something else, treating the underlying cause can restore your mental clarity. In the meantime, keep your brain active with puzzles, reading, or learning new skills. Stay socially connected. Isolation worsens memory problems. Make sure you're getting good sleep, as poor sleep significantly affects memory. Use calendars, pill organizers, and notes to help compensate for minor memory issues while you seek evaluation. 3. Mood changes or depression. Feeling sad after losing a spouse or friend is natural, but persistent sadness, losing interest in activities you once enjoyed, or experiencing a major personality change is not a normal part of aging. In fact, depression in older adults is often overlooked because people assume it's just part of getting older. It's not. Depression in older adults often looks different than in younger people. You might not feel sad in the classic sense. Instead, you might find yourself losing interest in hobbies or social activities, feeling unusually irritable or anxious, having unexplained aches and pains, sleeping too much or too little, feeling worthless or burdensome to others, having difficulty concentrating or making decisions, or experiencing changes in appetite. If your family says things like, "You're not yourself lately," or "You never want to do anything anymore," listen to them. Sometimes others notice changes before we do. Major personality changes, like a normally easygoing person becoming anxious or agitated, can also signal depression or other health issues. Depression isn't just about feeling blue. It affects your entire body. It weakens your immune system, worsens chronic conditions like diabetes or heart disease, and increases your risk of falls and other accidents. Depression can even cause memory problems that mimic dementia. The good news is that depression is highly treatable at any age. Beyond standalone depression, mood changes can be early warning signs of other conditions. Thyroid problems, vitamin deficiencies, chronic pain, and even early stages of dementia can present as mood changes. Some medications, including blood pressure drugs and steroids, can affect mood as a side effect. Treatment for depression in older adults is very effective. This might include carefully chosen antidepressant medications monitored for older adults, counseling or therapy, which works well even via phone or video, treating underlying health conditions, adjusting medications that might be contributing, and connecting with social support and activities. If you've been feeling down for more than 2 weeks, talk to your doctor. Be honest about your symptoms. There's no shame in depression, and your doctor has heard it all before. If you're having thoughts of suicide, don't wait. Call your doctor immediately, or the 988 Suicide and Crisis Lifeline. Remember, depression is a medical condition like diabetes or high blood pressure. It's not a character flaw or something you should just snap out of. 4. Falls or balance problems. Have you found yourself grabbing furniture for support more often? Have you had a fall or near fall recently? While many people think falls are just part of getting older, they're actually warning signs that something needs attention. Here's an important fact. Every fall doubles your risk of falling again, so it's crucial to address balance problems early. Beyond the obvious risk of broken bones, falls can start a downward spiral. Fear of falling again can lead to less activity, which weakens muscles and actually increases fall risk. Many older adults who fall once end up limiting their activities, becoming isolated, and losing independence, all of which could be prevented by addressing the underlying cause of the falls. Falls rarely have just one cause. Often it's a combination of factors working against you. Muscle weakness is a big one. We lose muscle mass as we age, but this loss accelerates if we're not active. Vision problems like cataracts or incorrect glasses prescriptions can make it hard to see obstacles. Medications are another major culprit. Blood pressure drugs can cause dizziness when you stand up, sleeping pills can make you groggy, and taking 4 or more medications increases fall risk significantly. You might also be dealing with foot problems or poor footwear. Those worn slippers aren't doing you any favors. Low blood pressure when standing up can make you dizzy. Inner ear problems can affect balance. Vitamin D deficiency weakens muscles. Even something as simple as dehydration can affect your balance. And don't forget about home hazards like throw rugs or poor lighting. Tell your doctor about any falls or near misses. Don't be embarrassed. They need this information to help you. They'll review all your medications and might adjust doses or timing. They'll check your blood pressure lying down and standing up, test your vision and hearing, examine your feet and watch you walk, and possibly order blood tests to check vitamin levels. You can take action immediately to reduce your fall risk. Start with simple exercises. Stand on one foot while holding onto a counter, then gradually try to balance without holding on. Walk heel to toe along a hallway. Consider Tai Chi classes, which are excellent for balance. Make your home safer by removing throw rugs, adding grab bars in the bathroom, improving lighting especially on stairs, and keeping pathways clear. Wear shoes with non-slip soles, even indoors. Have your vision checked annually and update prescriptions as needed. Take vitamin D supplements if your doctor recommends them. Most importantly, stay active. The phrase "use it or lose it" definitely applies to balance and strength. 5. Shortness of breath. Finding yourself breathing harder after climbing stairs? Need to catch your breath during conversations? While it's true that our maximum exercise capacity decreases somewhat with age, becoming significantly short of breath during normal activities is not part of healthy aging. This is your body telling you something important. Pay attention if you're getting winded doing activities that didn't bother you before, needing to sleep propped up on pillows to breathe comfortably, waking up at night gasping for air, breathing heavily during simple tasks like getting dressed, or noticing your breathing getting progressively worse over weeks or months. The key is change from your normal. If you could walk to the mailbox easily last year but now need to stop and rest, that's significant. If you find yourself avoiding activities because you know they'll make you breathless, it's time to see your doctor. Your heart and lungs work together to deliver oxygen throughout your body. When either system has problems, you feel short of breath. Your heart might be struggling with heart failure when it can't pump effectively. You might have heart valve problems, like a narrowing of the aortic valve. Abnormal heart rhythms or coronary artery disease reducing blood flow to the heart can also cause breathlessness. On the lung side, COPD or emphysema are common in former smokers. Asthma can develop or worsen in older age. Lung scarring, blood clots in the lungs, or lung infections can all make breathing difficult. Don't forget that anemia, low red blood cells, means less oxygen delivery throughout your body. Being significantly overweight puts extra strain on your breathing. And yes, anxiety can cause breathlessness, though this should only be diagnosed after physical causes are ruled out. Your doctor will listen to your heart and lungs, check your oxygen levels, and likely order several tests. These might include a chest X-ray, electrocardiogram, blood tests including something called a BNP test for heart failure, and possibly an echocardiogram or pulmonary function tests. These tests aren't painful and provide valuable information about what's causing your symptoms. Treatment depends on the cause, but many conditions improve significantly with proper management. Heart failure responds well to medications and lifestyle changes. COPD can be managed with inhalers and pulmonary rehabilitation. Anemia often improves with iron supplements or treating the underlying cause. The key is getting diagnosed so you can get the right treatment. In the meantime, pace yourself during activities. Use a fan. The breeze on your face can reduce the sensation of breathlessness. Practice pursed lip breathing. Breathe in through your nose, out through pursed lips. Keep track of what makes your breathing worse to report to your doctor. 6. Chest pain or pressure. Let me be very clear about this. Chest pain is never normal at any age. Too many people, especially older adults, ignore chest pain thinking it's just indigestion, a pulled muscle, or part of getting older. This dangerous assumption leads to delayed treatment of heart attacks and other serious conditions. When it comes to chest pain, it's always better to be safe than sorry. Heart-related chest pain doesn't always feel like what you see in movies. It might feel like pressure, squeezing, or fullness in your chest. The pain might spread to your arms, back, neck, jaw, or stomach. You might have chest discomfort that comes with shortness of breath, nausea, lightheadedness, or cold sweats. Sometimes the pain gets worse with physical activity and better with rest. Women and older adults often have what doctors call atypical symptoms. You might have just shortness of breath, unusual fatigue, or what feels like indigestion. Some people describe it as an elephant sitting on my chest, while others say it's more like uncomfortable pressure. During a heart attack, every minute counts. The longer you wait, the more heart muscle can be damaged. Modern treatments can stop a heart attack and prevent damage, but only if you get to the hospital quickly. Many people wait hours or even days before seeking help, often with tragic results. Beyond heart attacks, chest pain can signal other serious conditions. You might have an aortic dissection, a tear in your body's main artery. A pulmonary embolism is a blood clot in the lungs. Severe heart valve problems, or unstable angina, which is a warning sign of an impending heart attack, can also cause chest pain. Even if the cause turns out to be less serious, like acid reflux or muscle strain, you won't know without proper evaluation. If you have chest pain that's new, severe, or different from anything you've felt before, call 911 immediately. Don't drive yourself to the hospital. While waiting for the ambulance, sit down and try to stay calm. If you have nitroglycerin prescribed, take it as directed. Chew an aspirin if you're not allergic and your doctor hasn't told you to avoid it. For less severe but recurring chest pain, see your doctor promptly. They may order tests like an ECG, stress test, or cardiac catheterization to check your heart's blood flow. Remember, it's not bothering your doctor to report chest pain. It's exactly what they want you to do. While you can't eliminate all risk, you can take steps to protect your heart. Manage your blood pressure, cholesterol, and diabetes. Stop smoking. It's never too late to benefit. Stay physically active as approved by your doctor. Maintain a healthy weight and manage stress. Take prescribed heart medications consistently. Know your family history and share it with your doctor. If you have known heart disease, make sure you understand your treatment plan and warning signs to watch for. 7. Extreme tiredness or weakness. We all have days when we feel tired, but I'm talking about something different here. A tiredness so profound that it interferes with your daily life. When getting dressed feels like running a marathon, when you need a nap after breakfast, or when you're too exhausted to enjoy activities you love, that's not normal aging. That's your body sending an urgent message. This kind of fatigue goes beyond being a little tired. You might feel exhausted even after a full night's sleep, be too tired to do routine activities like grocery shopping, experience weakness in your muscles that makes simple tasks difficult, need frequent naps but still feel unrefreshed, or notice fatigue that's gotten progressively worse over weeks or months. One patient told me, "I feel like someone pulled my plug." Another said, "It's like trying to walk through molasses." If these descriptions resonate with you, it's time to investigate why. Fatigue is often your body's way of saying it's working hard to deal with an underlying problem. Anemia, low red blood cells, is extremely common and often missed in older adults. It can result from iron deficiency, chronic diseases, or hidden bleeding. Thyroid problems, especially an underactive thyroid, can make you feel like you're running in slow motion. Heart disease can cause fatigue because your heart can't pump enough oxygen-rich blood to meet your body's needs. Diabetes with poor blood sugar control saps your energy. Kidney or liver disease affects your body's ability to remove toxins, leaving you drained. You might be fighting chronic infections without realizing it. Sleep disorders like sleep apnea are more common than you might think. Many medications, beta blockers, antihistamines, and others, list fatigue as a side effect. Depression often shows up primarily as exhaustion in older adults. Even nutritional deficiencies beyond just iron can leave you depleted. The first step is figuring out what's causing your fatigue. Your doctor will likely start with blood tests, checking for anemia, thyroid function, kidney and liver function, vitamin levels, especially B12 and D, blood sugar, and signs of inflammation or infection. They'll review all your medications. Sometimes simply adjusting timing or doses can make a huge difference. If sleep apnea is suspected, a sleep study might be recommended. While waiting for your appointment, keep an energy diary noting when you feel most and least tired. Pace yourself. Break tasks into smaller chunks with rest periods. Stay as active as you can. Gentle exercise like walking can actually boost energy. Eat regular, balanced meals and stay hydrated. Avoid alcohol, which can worsen fatigue. Most importantly, don't accept extreme fatigue as inevitable. With proper diagnosis and treatment, most people can regain significant energy and quality of life. 8. Changes in bathroom habits or bleeding. I know this isn't the most comfortable topic to discuss, but changes in your bowel movements or finding blood in your stool are serious warning signs that need immediate attention. Too many people suffer in silence, embarrassed to talk about bathroom issues, or assume these changes are just part of aging. They're not, and staying silent could be dangerous. Pay attention to any persistent change from your normal pattern. You might notice going from regular bowel movements to being constipated for weeks, or developing chronic diarrhea when you've always been regular. Your stools might become pencil thin or ribbon-like. You might feel like you can't completely empty your bowels, or find yourself alternating between constipation and diarrhea. Any blood is concerning, whether you see it on the toilet paper, in the bowl, or mixed with stool. Black tarry stools indicate bleeding higher in the digestive tract and need immediate attention. Persistent abdominal pain or cramping with bowel movements is another warning sign. Remember, everyone's normal is different. The key is a change from your normal pattern that lasts more than a few days. The biggest concern with these symptoms is colorectal cancer, which is highly treatable when caught early, but can be deadly if ignored. Colon cancer is most common after age 50 and often starts with subtle changes in bowel habits. The good news is that screening can catch it early or even prevent it by removing precancerous polyps. Other possible causes include diverticular disease, small pouches in the colon that can cause pain, bleeding, or bowel changes. Inflammatory bowel diseases can start even in your 60s or 70s. While hemorrhoids are a common cause of bright red bleeding, never assume this without proper evaluation. Infections can cause temporary but significant changes. Many medications affect bowel function. Ischemic colitis, where reduced blood flow to the colon causes pain and bleeding, is another possibility. Don't wait to see if symptoms go away on their own. See your doctor promptly for any persistent bowel changes or bleeding. They'll likely recommend a colonoscopy, the gold standard for evaluating the colon. I know the preparation isn't pleasant, but the procedure itself is done under sedation and could save your life. Blood tests will check for anemia from blood loss. Stool tests can detect hidden blood or infections. Your doctor will review your medications since many can affect bowel function. Stay up to date with colon cancer screening. Guidelines recommend screening until at least age 75, sometimes longer for healthy individuals. Eat a high-fiber diet with plenty of fruits, vegetables, and whole grains. Drink plenty of water. Dehydration worsens constipation. Stay active, as exercise helps maintain regular bowel movements. Limit red meat and processed meats. Don't smoke, as it increases colon cancer risk. If you're too embarrassed to discuss these symptoms, remember that doctors deal with these issues every day. Your health is too important to let embarrassment get in the way of potentially life-saving diagnosis and treatment. Conclusion: taking charge of your health. We've covered a lot of ground today, and you might be feeling a bit overwhelmed. That's okay. The important thing is that you're now armed with knowledge about what's not normal aging and what deserves medical attention. Let's recap the 8 warning signs we've discussed: unexplained weight loss, memory problems that interfere with daily life, persistent mood changes or depression, frequent falls or balance problems, shortness of breath during normal activities, any type of chest pain or pressure, extreme fatigue or weakness that limits your activities, and changes in bowel habits or any bleeding. These symptoms are not inevitable parts of aging. They're signs that something specific is happening in your body that needs attention. The human body is remarkably resilient, and many conditions that cause these symptoms are treatable or manageable when caught early. I want to leave you with some important takeaway messages. First, trust your instincts. You know your body better than anyone else. If something feels wrong, it probably is. Don't let anyone, including yourself, dismiss your concerns as just aging. Second, speak up. Your doctor can't help with problems they don't know about. Be honest and thorough when describing your symptoms. If you're not getting answers, ask more questions or seek a second opinion. You deserve to have your concerns taken seriously. Third, take action. Knowledge without action won't improve your health. If you recognize any of these warning signs in yourself, make that doctor's appointment. If you've been putting off recommended screenings or tests, schedule them now. Your future self will thank you. Fourth, stay hopeful. Many people assume that aging means inevitable decline, but that's simply not true. With proper medical care, many older adults maintain excellent health and active lifestyles well into their 80s, 90s, and beyond. The key is catching and treating problems early. Finally, remember that you're not alone. Share this information with friends and family. Look out for each other. Sometimes others notice changes in us before we see them ourselves. Creating a community of support can make all the difference in maintaining good health as we age. Your health is not a luxury. It's a necessity for living the life you want. Don't settle for feeling unwell because you think it's normal. Don't suffer in silence because you're embarrassed or don't want to be a bother. Your symptoms matter. Your quality of life matters. You matter. Take this information and use it. Be proactive about your health. Ask questions. Seek answers. And most importantly, never accept "it's just your age" as an explanation for symptoms that are interfering with your life. You deserve better, and with the right medical attention, better is possible. Here's to your health, your independence, and your continued vitality. Remember, aging is inevitable, but suffering is not. Take care of yourself. You're worth it.